My name is Eileen Hacker, and I am a professor and chair of the Department of Nursing. The Argyros Postdoctoral Research Fellowship is housed in the Department of Nursing. Our department has 4 pillars: research and funding, dissemination and reach, education and training, and APRN administration and governance. So the postdoc fellowship falls within our education and training as well as our research pillar. And I have with me today 2 of our postdoctoral research fellows. And so we're so happy to talk about this program. It started in, our first fellow started in November 2021. I joined MD Anderson in May of 2022, and the formal program started that September. We currently have 3 fellows. Dr. Anju Choi, who was our first fellow, who is now funded with a K99R00. We have Dr. Karen Alsbrook, who is our second fellow, and I'll let her talk about herself. She's wonderful. And then we have Dr. Gisele Tlusty, who is our third fellow in her first year. So proud. It's such an honor to work with each of these individuals.
Thank you for the introduction, and thank you for having us here today. So I'm in my first year of the postdoctoral fellowship, and I heard about the fellowship through Eileen, who was in my dissertation committee. So I applied and was chosen to join, and I'm very happy that I did. It's been a great opportunity so far. Eileen is just a wonderful mentor. But it gives us so many opportunities. Like, she's always thinking about where we could submit our research for abstracts, and because of her, I submitted to the tandem meetings this year, and I presented my abstract and won an award for second place best nursing research abstract. It's really exciting to be there and share my research, and I'll be getting ready to start a study soon that is going through the IRB right now, but it's looking at sleep and physical activity in stem cell transplant patients and their caregivers in the transition from hospital to home. So we're going to look at their physical activity and sleep patterns and see if there's any potential interventions we can develop to help them transition from hospital to home.
And that's such exciting work and so important. And I'm so happy that you're doing it. It's really, really exciting. And on the same vein, I'm really excited about my work as well. I'm Dr. Karen Alsbrook, and I am a third-year postdoctoral fellow at MD Anderson. Very honored to be at MD Anderson, receiving wonderful mentorship from Eileen, Dr. Hacker, and getting to the honor of working with Gisele and Dr. Anju Choi. So it's really been an honor and a privilege to be there. It seemed like when I came to MD Anderson, I had just defended at the University of Pittsburgh, and I had this armload of groceries. I had my skills that I had from nursing for 18 years, and then I had all this research knowledge, and you got this armload of things, and you're just not sure what quite to do and what are the next best steps. And so Eileen has just been so instrumental in helping me really build that into a trajectory of research. And just in the almost 3 years that we've been working together, we've accomplished so much. We've completed a systematic review of the concept of opiophobia. We also have done a record review of all the opioid waste for 1 year at MD Anderson. And we have already completed data collection on a sample of 50 people who had just had surgery, trying to understand their perspectives on taking pain medicine postoperatively. And we're excited to see what those results bring. And I too also have a study at the IRB, which is another 50 patients looking at advanced cancer. So I'm trying to understand where this fear of opioids really resides. And Eileen has just been phenomenal in helping me to understand how to do that. And MD Anderson is so blessed with so many resources. I also have the privilege to work with Dr. Eduardo Bruera in the Palliative Care Center, and he has a wonderful perspective too. So to have that physician's perspective as well has just been such a great help, and I'm so excited about moving forward. So thank you, Eileen, for the opportunity and for the mentorship that you provide. It really means a lot.
Well, I will say it is an honor and a privilege to work with our postdoctoral research fellows. They are highly knowledgeable. They are wonderful nurses, which is, I think, a baseline requirement. Wonderful nurses, highly knowledgeable, highly intelligent, compassionate, hardworking. Hardworking is so important, because to be a researcher, perseverance is one of the most important characteristics, because many times we have to submit over and over again for funding, for papers, and you have to somewhat develop some thick skin. So our goal as a postdoctoral research fellowship is to really provide the necessary training, both methodological training, training related to concept development, how to logically develop a study, how to design, implement, finish, and then disseminate the study, and then move to your next study. So it's not just about the study that's right in front of you, it's about, so what? So if you find this in your studies, what are you going to do next? So if this, then what? And I think that's really wonderful, because what we expect and what we hope, and I'm sure both of these wonderful nurse scientists will accomplish, is they will be able to launch their independent research career after this. And I fully expect that they will be the future nurse scientist stars in oncology nursing in the coming years. So really, it's been such a pleasure to work with this. So it makes my job really actually very easy, because we work well together. I think we all work well together, and we're addressing important topics. And we need scientists, because as a discipline, as a clinical practice discipline, our practice needs to be based on evidence. And we need people to actually generate that evidence, which would be the nurse scientists. And our pipeline is somewhat drying up because we have fewer people entering PhD programs as opposed to DNP programs. So we're hoping that our talk yesterday, our research roundtable talk, which we can talk a little bit more about, we're hoping that this really does generate more interest in people thinking more about becoming a nurse scientist and really going the route of the PhD degree. So thank you. The Argyros Postdoctoral Research Fellowship in Oncology Nursing is funded by the Argyros Family Foundation, for which we are incredibly thankful for their generous support for this particular fellowship. And over the past 3 years, we have had really exceptionally qualified applicants, and have had to turn away actually very qualified applicants. The interview process begins with a written application. We do interviews. They also do a presentation, because we're interested in learning more about their scientific communication skills, as well as about the work that they were currently engaged in, and then the work that they hope to do. So we're hoping to continue this program. It's really been a wonderful addition to MD Anderson. We have really, I think, at MD Anderson, the whole notion of nursing science and building nursing science, we have spread that out throughout the organization. We have over 50 PhD prepared APRNs and other people who are now also very interested in building out their own research portfolios. So we have the Argyros Family Foundation to thank, and we are incredibly thankful. And we hope to be able to continue this program. And we hope that we will continue to get really highly, highly qualified applicants.